Oh, hi guys. I just got so much to talk about. Like this one is so like, oh my god. I know I complain a lot. I'm trying to stop that. That's a bad habit. But yeah, respiratory is not my favorite. It's really not my favorite, but um yeah. Let's go over airway obstruction. I think we can only do one thing at a time really because there's a lot that goes into everything. So now I would like to talk about airway obstruction. So I was gonna say imagine you go out to lunch with your friend, and I'm picturing my friend that I really liked. You go out with your friend to lunch or dinner. Dinner is more fancy, and you guys are good. You guys are eating. Everything is like perfect, and then all of a sudden, your friend goes like, and then he probably like had some chicken that went to the wrong spot. What do you do? Or let's say your friend is probably has hypertension, and he's on the medication, and one of the side effects is that it causes like inflammation to the airway. So you guys are eating lunch. I'm still using lunch because I like lunch. I like dinner. You guys are going out to eat. You guys are eating. You guys are vibing, and then all of a sudden he's like, "What do you do?" The mood has been like, what do you do? So that's what we're gonna talk about today. What are the First of all, what is an airway obstruction? An airway obstruction is just something that kind of stops you from breathing. So it could be like we talked about aspiration of food. It could be inflammation of the airway, like edema, like inflammation of the airway. It could be like just stenosis, like your throat becomes kind of like hardened, like and it becomes so tiny that air is not able to pass by. It could be somebody who probably had like asthma and the throat is constricted and inflamed. It could be a tumor, and that's the one thing I gotta look into when it comes to like giving oxygen with like an actual obstruction there. It could be even like neurodepression. Let's say your friend takes opioids and you didn't even know that he takes like opioids. So that is that. So what are the what are the signs that somebody is having trouble breathing? You will see they'll be hyperventilating, like like that. If they don't do that, they will probably go like this, where you have to do the Heimlich maneuver. It's good to know who you're with, like so you know like how to respond. They might have like signs of anxiety, like sweating, like what's the other one, like inability to speak. And like I said, I have a funny story about like me working with a specific patient. I think I can talk about it now since I'm just doing airway obstruction on this video. So I was working with this patient. This was 3 years ago because your girl hasn't worked since last year. I'm ready to work. Anyway, 3 years ago, I was working as a direct care staff with this patient, and at the time, I don't know what's wrong with my brain. Like, I don't know. I guess I need to learn a lot. I have to be out there and learn a lot. But I didn't know my patient like that. Like, I knew like, oh, this is what she does. She eats. This is what I do. But the thing is, I needed to know that she had anxiety. That was an important thing to know. But I didn't know that. So one day, she was like, I can't breathe. I can't breathe. So I'm thinking to myself, oh, you're choking? Are you choking? So I'm there going like, uh, on her, and like doing the ham like on her, like, and then I sat down. I'm like, but you were able to talk. So that's to say, like, if somebody is choking, they're not gonna be able to speak. Yeah. So that is just one story from the same person, the same client. So they're gonna be gagging. As a nurse, you should know what a stridor is, like what it sounds like or something like that. Coughing, like coughing a lot, like, and things like that. Respiratory arrest, so they might even just stop breathing. Then that's when you probably have to do airway. What is it? Head tilt. What is it? Head tilt chin lift. So they can open the airway, give your breaths and do your CPR. But yeah, So my other patient too. She was how is that related to what I was talking about? Let me think about this for 1 second. But yeah. She like we'll talk about that later. So so with these things, then there's emergency interventions. You can do head tilt chin lift. You can do the Hamlet like I talked about. You can do the endotracheal or nasotracheal intubation. With the endotracheal intubation, orotracheal being the best because of the risk of less infection. Again, this tube, usually, it's important for me to know this because, like, I remember last year, even though I knew about this stuff, like about the I didn't like it at all, but I mean, I knew a little bit about it. My dad had a COVID last year, and when we hear oxygen in my house, it's like, oh my god, it's so bad. So you gotta know, like, I'm gonna go into respiratory modalities later, like in the next video, but you gotta know like what they mean by oxygen. What is that? So intubation, they literally put like a tube in your mouth all the way down to your trachea, and the problem with this is like they'll go through your epiglottis, because your epiglottis is what kind of like opens and closes to stop food from going through. So think about it, you can have epiglottitis with this. You could have infection, sepsis. You could lose your gag reflex. The cough reflex might go down. You might have some trauma there, like ulcers and things like that. So it's just not like a great place to be. You're sedated, like you're not able to talk, you're not awake when you're having this endotracheal tube. And then if you stay on that for like 14 days, they will take it out and put a tracheostomy, which is like, a hole. And what I just noticed is so cool is like, when you have a problem, it's kind of like a car. It's like you have a problem with your airway, they put a hole in your airway so you can breathe. You have a problem with your stomach, they put a hole in your stomach so the poop can come out. That's what I should have known this from a long time, but that's what I just noticed. But yeah, the trachea, they'll put a hole in your trachea, put like a little thing there so that you can breathe through there. So you're not breathing through your mouth anymore. You're breathing in through your trachea. And the thing with this is like, think about it. When you're breathing in through your nose, you have that cilia that stops infection from going through. You have that humidification going on. But when it's down here, there's secretions going on and stuff. So it becomes thick and all of that stuff. The gunk is coming out. So like, you need the room to be humidified for this patient who has that. You're gonna need to have that inside here. But the good thing about this though is like you're still able to talk, you're still able to eat and stuff like that. So that's the good thing about that. But yeah, they use this, and then they'll suction is just pretty much like taking like this. I used to think it was that other tube that just sticks around it, but suction is literally like a long catheter that they put inside there, and they remove gunk, like when you kind of spit that thing coming out. That's what they use for that. But we can talk about like suctioning. Well, if you go to the hospital and they have to suction you, you have to know like, okay, when they suction you, they're taking in some oxygen with it too, so hypoxemia, and it can also cause arrhythmia. So the nurses have like specific ways that they go into suction you. It's like when they go in into your trachea, when they suction, they go in without oxygen. Once they get in there, but before even that, they have to oxygenate you, give you oxygen so that it can replenish for what they're taking out. So they oxygenate you, they go in without that suction around less than 10 seconds, take it out, and so on and so forth. But the whole thing is like, they don't want to deplenish you of your oxygen. What is the other thing about? Yeah, it can cause like hypotension or hypertension, cardiac arrhythmias, and think about if you're putting something there, it can cause trauma and it can cause infection. So yeah, that is it for this video really. But no, okay, before we move on, before I say that's it, but they even have indications for suctioning. Like you have to have had trouble coughing it up, yourself, you have to maybe have low O2 stat. Maybe they listen to your lungs, they notice that there's gunk in there, like way too much. Yeah, there has to be a reason for them to go in with that suction thing, because again, like you said, it can cause arrhythmia, or it can cause your heart to kind of like cause hypertension, hypotension, low oxygen going onto your body. And all this, even though it's gunk that we're taking out, nasty, it's still sterile. Like they have to do it in like in a sterile, like sterile meaning it has to be like super super clean when they do this. But that's it for my video. Thanks for watching. On the next video, I'm going to talk about, what am I going to talk about? I'll talk about the mechanical vents. And yeah, that's it. And yeah, I'll talk about mechanical vents on the next one, and then we'll talk about cancer of the larynx. And thank you for watching my video. Peace. Bye.